Hello and welcome to Nursing Mastery. If you are a nurse, a nursing student, or any healthcare professional who has ever sat through a training session and thought there has to be a better way to learn this, then you are in the right place. Today, we are kicking off our series by diving deep into a foundational topic, adult learning theory. This isn't just academic jargon, it's the science-backed manual for how your brain learns best as a professional. By the end of this video, you'll understand not just what it is, but how to use it to learn faster, retain more, and make your professional development truly stick. Let's get started. So what exactly is adult learning theory? In simple terms, it's a set of principles that explain how we as adults acquire, process, and retain knowledge differently from children. It emphasizes that we are self-directed, motivated by practical application, and we bring a whole lifetime of experience to the table. Now let's get our definitions straight, because words matter. An adult. This isn't just about age. It's about someone who performs adult rules. A nurse, a spouse, a parent, and critically someone who sees themselves as responsible for their own life and learning. Learning, it's not just memorization. It's an active process of acquiring new knowledge and skills that leads to a change in your behavior or understanding. Theory. This isn't a guess. It's a well-supported framework of ideas that explains how something works. Now, before we go further, we need a tool to understand ourselves better. Enter the Johari window. Imagine your self-awareness is a house with 4 rooms. The open area. This is what you and everyone else knows about you. For example, your colleagues know you are great at starting IVs. The blind spot. This is what others see in you, but you don't. Maybe you have a habit of tapping your pen when you're stressed, and it distracts others, but you don't realize it. This is why constructive feedback is so valuable. The hidden area. This is what you know but choose to keep private, like your insecurities about a certain procedure. The unknown area. This is the most exciting room. It holds your untapped potential and talents you haven't discovered yet. The goal of a self-directed learner is to expand the open area by seeking feedback, shrink the blind spot, and by courageously exploring the unknown through new learning challenges. This brings us to the heart of the matter, andragogy versus pedagogy. Pedagogy is the method of teaching children. It's teacher-centered. The teacher decides what, how, and when to learn. Motivation is external. Grades, gold stars, avoiding punishment. The child is a dependent learner. Andragogy, a term popularized by Malcolm Knowles, is the approach for teaching adults. It's learner-centered, focuses on self-directed learning. You take control of your goals. Experiential learning. You learn by doing and reflecting on your experiences. Problem-centered learning. You learn what is immediately relevant to solving your real-world problems. Internal motivation. You're driven by career advancement, personal growth, and the desire to provide better patient care. When you're frustrated with a training that feels like it is talking down to you, it is often because it's using pedagogy, when it should be using andragogy. Let's break down those 5 principles. Think of these as a recipe for effective adult learning. Self-concept. We move from being self-dependent personalities towards being self-directed human beings. We want to be the drivers for our learning journey. Experience. We accumulate growing reservoir of experiences that becomes a rich resource for learning. Our path shifts from being a baggage to a library. Readiness to learn. Our readiness to learn becomes oriented to the developmental tasks of our social and professional rules. We learn what we need to know. Orientation to learning. Our time perspective changes. We want to apply knowledge now. Our learning is problem-centered, not content-centered. Motivation to learn. While we respond to external motivators, the most powerful motivators are internal: self-esteem, recognition, better quality of life, and self-confidence. Of course, this journey has roadblocks. The barriers for adults are very real: lack of time, money, or information. Practical issues like childcare and transportation. Sometimes our own motivation can be a barrier when we're balancing a dozen responsibilities. Understanding these barriers helps us overcome them, and they lead to key characteristics of how we learn best. We are self-directed and goal-oriented. We are pragmatic and relevancy-focused. We need to be respected for our experience. We are often juggling learning with our life duties. So how do you put this all into practice? Here are some powerful tips for success. Get organized and set a schedule. Your brain loves structure. Plan your learning. Don't multitask. Focus on one thing at a time. Your brain can't effectively do two cognitive tasks at once. Divide it up. Use chunking. Study and focus 25-minute blocks instead of 3-hour marathons. Sleep. This is non-negotiable. Sleep is when your brain consolidates memories and learning. Learn from mistakes. See every error not as a failure but as a data for improvement. Teach what you've learned. The best way to solidify your knowledge is to explain it to someone else. In conclusion, adult learning theory empowers you to take control. You're not a passive student. You are an active professional learner. Use this principle to direct your own growth. Seek out relevant knowledge and transform your career. If you found this video helpful, please give it a thumbs up and subscribe to Nursing Mastery for more content that helps you excel in your nursing career. Now, I'd love to hear from you. What is the biggest challenge you face when learning something new in nursing? Let's start the conversation in the comments below. Thanks for watching. Keep learning, keep growing, and we'll see you in the next video.